Honored to be here with so many people who are committed to improving seniors' care. I'm here on behalf of the Care Providers Board, the Safe Care Board, but I'm also in my day job the CEO of Three Links Care Society. We've been delivering quality seniors' care housing services to residents in Vancouver's Renfrew-Collingwood neighborhood for 35 years. This is our 35th anniversary, and we've marked the occasion with the development of a new strategic plan, and certainly the issue of health human resources. Recruiting and retaining a quality professional team is top of the list. And pleasure to be joined here by Marilyn Hurford, who's on our board, and Faria Ali, who's our Director of Care. Daniel's asked me to speak a little bit about the BC Cares initiative, which I was a part of when I worked with the BC Care Providers Association a number of years ago. A bit of the past and present. I'll build a bit on Daniel's overview, which I thought was terrific. I'll give you a little bit of an introduction, and I'll run through the first program, the sequel, as we called it, and then the potential for renewal, and just a couple of conclusions that I drew from my experience in the program, and I'll do that before the orange card goes up in the back. The association, as Daniel said, established the initiative in 2007. It was to address the current and anticipated shortages in the sector, collaboration with a lot of the key players that Daniel talked about. 07-08 was approximately the time. It was done in response to the provincial government's plan to increase the total number of long-term care beds in the province, so very connected to provincial action and provincial investment, which I think is certainly the current situation. An emphasis on recruiting new people into the sector, a very grassroots campaign. It wasn't a huge budget, but we made the most of it. The province essentially purchased the seats at the colleges for the care aides. The Ministry of Advanced Education provided some grants, and we learned a lot of lessons from that program, and one of it was it worked. If the sector got together, worked with the provincial government, and we got the messaging right, we are able to fill up those spaces and recruit more care aides. The sequel came during the recession. The labor shortage was intense, but we got a reprieve in 2008. A lot of the older workers who were supposed to retire did not. Their nest eggs had been hit by the stock market downturn. Maybe their spouse had lost a job, and they didn't leave. But we still knew there were fundamental problems in the sector, so we went ahead with the sequel to the program, and it allowed us to take a little bit of a deeper dive into some of the numbers and some of the data, and really what were some of the challenges, because we knew the problem was going to come back when the economy recovered. We did a more detailed analysis of some of these challenges, and that included the home support sector. And I think the piece on data is key because we did have HEABC at the table, and they did a significant analysis of the challenges with the affiliate sector, the contracted providers. We found that traditionally governments were relying on HR data that was coming out of the health authorities only, and there was a strong sense that the affiliates were experiencing more acute challenges, and in particular in home support as well, and the data that was delivered over that period of time bore that out. One of the issues, of course, that allowed us to get a little deeper into the issues was the emergence of safety and the injury rates as being a key factor for retention. So that brought WorkSafe BC to the table, and then Safe Care BC was created essentially as a legacy of BC Cares 2. And of course, we're seeing the excellent work now of Safe Care BC with the partners that were around the table for BC Cares 2, starting now to have a real impact on injury rates despite the pressures and the acuity getting worse. The renewal I won't talk too much about because Daniel talked a little bit about that. It's a response, I think, now to a return of acute shortages in the post-recession environment, focusing on a broader range of professions. The first program was really zeroing in on care aides and nurses. I think we all know that the challenges is much broader than that, and can include a number of elements that are listed there, which Daniel has talked a little bit about as well. Just some basic conclusions and observations. I think that the key piece about shortages across all elements of the sector, speaking with my CEO hat on, I see that every day. It's not just healthcare aides and nurses. Recreation is another area. You know, Isabel's reports and Seniors Advocate are talking a lot more about quality of life. the type of programming we're offering and what is becoming really a palliative care environment. How do you offer those kind of recreation activities to people with that kind of acuity? Kitchen staff with an increased emphasis on food and the importance of nutrition, a whole host of things right on down the line, and I was happy to see doctors on that list as well. I think we need to keep the pedal to the metal on workplace safety, and we still have a long way to go. SafeCare has done a great job, but I think there's a lot more that can be done, and a real opportunity to integrate the colleges much more into the work that SafeCare is doing. I think we also need to talk about the role of volunteers in the seniors care sector. We hear a lot about loneliness and isolation, and I have seen firsthand the inspiring examples of people from the community who have no attachment to these seniors, who come into the home and volunteer and want to spend time with them, and they can make a real difference in quality of life. So I would encourage all of you to consider your volunteer programs. Intergenerational programming, I think, goes a bit to the issues that Daniel was talking about in the schools, but I think that there are lots of great examples of intergenerational programming happening that are win-wins, and to get young people exposed early to that kind of compassionate care and that empathy that goes on in long-term care that we all know about, I think can really help them in their career paths. The K-12 piece Daniel talked about, and I do believe that the national stage is ripe for a discussion about this. And I think if you look across the country, despite the challenges we have in BC, we are blessed with a really good seniors care system compared to other provinces. We're well advanced, and I think BC has a lot to offer on the national stage with the union partners and with others. So I think leadership is definitely required, and I think the proposals that Daniel and the provincial government are talking about, and you're all going to discuss today, can certainly take us down that road. So that's a little bit of an overview of the previous programs to provide some context maybe as to what some of the opportunities are ahead. Thank you.